So, Ms. London, I started seeing you back when you had a hospitalization in 2018 for really severe nausea, but your story actually starts a lot earlier than
2012.
That, with optic neuritis that was really bad on the left, and then your doctor saw you and felt it was significant MS, got you started right away on effective treatments for MS, which was Rebif initially. And you developed some problems pretty early on with nausea and vomiting, and your eye continuing to
Yes,
keep
sir.
coming back. And so it would always be sort of together when you had these events, right?
Yes, sir.
And so, but you were on Rebif for about 6 months, and then you went to Tecfidera, which is another effective drug
Yes, sir.
for MS. And how long were you on the Tecfidera? Do you recall?
About 5 years.
About 5 years. And that's actually a really good treatment for it. And you saw a neuro-ophthalmologist up in Louisville, and you followed with a local ophthalmologist there. And so it was pretty much, you'd have about once a year one of these episodes of optic neuritis. And would you usually have the nausea and vomiting with it?
Yes, sir.
Okay. And you would get steroids. Would
Yes,
the
sir.
steroids usually make everything better for a while?
They always bring me out of it.
Okay, all right.
Maybe not to where I was before, but the steroids are the relief that I have seen through my course of this disease.
And so then in December of 2018, you had a very prolonged episode of really severe nausea and vomiting, and you were hospitalized for that. Can you tell me a little more about what happened?
I was convinced I had the stomach bug to start with. Went to the emergency room at home 4 different times. The 4th time I knew the ER physician that was there, and she said, "Tiffany, I'm really convinced that this is not the stomach bug, that this is your MS, and if we don't get you to somewhere where there's a neurologist, you're not going to be here," because at this point in time I'd already started passing out every time I threw up.
Oh, wow.
So they transported me to the medical center in Bowling Green, which our hospital home was very rural, no specialist. And my neurologist at that time came in, ordered MRI, and I started high-dose steroids within 2 days of being admitted there. But I was still throwing up, passing out, and went into 3rd-degree AV block.
Okay. And you actually had a pacemaker
Yes, sir.
because of that. Okay. And did the MRI, was that seen, did the abnormality seen pretty early at that point in the hospitalization? Did they realize it was all due to the MS?
Yes, sir.
Okay. All right. And I'm going to pull up your MRI here. So, and the first thing we notice with your MRI head is there's actually, you have very little abnormal inside most of the brain. I mean, your brain looked a little bit older than you do, but just a few tiny marks. And this is more like a yawn to somebody who deals with MS. But what we saw when we looked a little closer, we saw down here in the bottom part of your brain that there was something abnormal right here. A very large, very irregular, and that's either an unusual area of inflammation or a tumor. And the radiologist might have read it either way. It's either a tumor or something else. And we could see when we looked at the brain, it was right around an area that is known for regulating gastrointestinal function, and it's very symmetric around it, and the blood pressure, automatic functions, nausea is very common in these areas. And so somebody who's fainting or having problems, and we see this, it's swollen and there's dye leaking out all around it, and this is a very unusual appearance on the MRI for multiple sclerosis. And I mean, it's either a very unusual kind of inflammation or a tumor that's causing that. We could actually see that there's very extended areas. This is the top of your spinal cord. This is actually the bottom of the brain, right where the spinal cord leaves the skull, and we could see it swollen through here. And that looked like when we looked at it, when we looked at water, we could see the whole area there at the bottom of the brain is swollen in that area. And this is a very dramatic and unusual finding. And so that's why we felt at that time it wasn't behaving like typical multiple sclerosis. And optic neuritis is really common in multiple sclerosis, and most of the time the optic neuritis in MS isn't bad. It can be bad, but it's usually not. And so the fact is this is involving the areas of the brainstem and spinal cord. They're very classic for this process, which is a much rarer kind of inflammation. In fact, it's so rare, many neurologists will never see a case. All right. And then we got a good look down your spinal cord. They had done some really good MRI scans, and you had difficulty having MRI because you had a pacemaker. So we were actually quite limited in what we could look at. So we take what we can get. If you look down here, there might be a little faint, hazy abnormalities, a few other of them in that area. Farther down, they could represent some other problems. So what was the feeling was at this time was this looked like MS in the beginning, but it really was this other illness we call neuromyelitis optica, or NMO for short, was known by a term called Devick's disease many years before the conventions were changed. And most doctors refer to this as the worst MS they've ever seen. And I'm sure your doctor used that term as well.
Yes, sir.
And that's because that's how it looks to them. And in years past, many of my patients who had these kind of problems, they died. And they died because we didn't know how to control it. And because these problems get in there where people breathe and they see, and they would become rapidly disabled, lose their vision, lose their mobility in their arms and legs. And when you came to see us, you were weak in all your arms and legs.
I was in pretty bad shape, Dr. Hunter.
And yeah, and it was quite concerning. And the first thing we do is slap you on a wonderful medicine that we call steroids, because steroids make it better temporarily. And in fact, it won't usually get worse while you're on steroids. And we got set up. We put you on an old immunosuppressive medicine, which it wasn't very pleasant, called azathioprine initially. It made you sick, but that helps us open up, and we were able to get approved for you rituximab, which is a drug that has been proven for many years now, for over 10 years, to be a very excellent treatment, to have a very acceptable risk to benefit ratio in terms of preventing problems. And we started trying to do what is the best test that we have on blood tests for NMO, which is called aquaporin 4 antibodies. And we've never been able to demonstrate those, but you have, when you read the book about NMO, everything about you is very typical. And we know that a significant fraction of people do not have positive tests for this, and we're not sure why, whether it's a different antibody they have or we just can't measure the antibody, but it's enough to do it. And so we got you started on that, and the last MRI that we had done just very recently, it looked virtually normal. You could barely see the problem at all. So we've been very successful, but you did have a significant relapse with some left-sided weakness and weren't walking well recently, and we've tried to get that. Can you tell us a little bit about the trouble you've had this year and how it's been going this year?
So this year I've had lots of trouble with walking. I've had some falls. I've never regained all the strength back in my left arm. But when I first started seeing you, I had no use of my left arm. I haven't had optic neuritis at all this year, though. If we make it till December 31st, this may be the first year I haven't had optic neuritis.
Wow. Okay.
But it's been more like walking, headaches, fatigued, some nausea, but not as bad as when I first started seeing you.
Okay. All right, wonderful. Well, I'm glad about that. And you've been on since you had a relapse fairly recently with the walking.
Yes, sir.
And you've been on steroids since then. Can you tell us about the side effects you have from that, the steroids?
Almost 100 pounds weight gain in a year.
Oh my.
But and sometimes they'll make me a little bit irritable, but I can tell when I start reducing them.
Yeah.
Every time it seems like I try to reduce them, I relapse. I don't think I can probably get out of the bed without them.
Okay. Well, it's something we go very slowly with, and we try to get other medicines in place, and you've gotten was it your third course of rituximab recently?
Yes, sir.
So, and then we've started looking into what other medicines we can get. There's some that aren't approved and available. There's one that's approved for people who have positive tests, but we're probably going to try to get that for you
Yes, sir.
if we can. And nobody knows what the best thing is to do in this situation. First of all, we can always hold tight and slowly get rid of the steroids and see if we just aren't lucky enough that it finally cleans it up and stops. That's the old way of doing it, but we try to be very proactive.
As long as I keep walking, I can deal with the weight gain.
So walking is good. And you had to stop working this year?
I stopped in December of 2017.
2017. So you've not been working for several years since you got
I received my disability in 3 months.
Okay. All right. So,
Yep.
all right. And you've had some other issues because of the steroids. You've had trouble with your blood sugar and you've
Yes,
had
sir.
trouble with your blood pressure.
Yes,
right?
sir. My A1C was 7, so I've recently started Victoza.
Good.
I have experienced some weight loss from that just in a few days.
Good.
Rather
Good.
proud of that. And I do have extremely high blood pressure.
And your bladder's giving you a lot of trouble
Yes, sir.
from this too. Okay. All right. All right. Wonderful. And then you're still on the mycophenolate.
Yes, sir.
We're trying to keep this
Yep.
under control.
I take it twice a day, every day.
Have you had any serious infections at all?
I had
since this
pneumonia
ended?
in June.
In June. And so
I took the
on
pneumonia
were you
vaccine.
on the steroids when you got
Yes,
the
sir.
pneumonia? Yeah, and so this is one of the big issues with pushing on people's immune system is they become more at risk. Did you have to be treated in the hospital for the pneumonia?
No, I was treated at home,
It was a
Levaquin.
milder medication. Okay. Well, we're just going to examine you just to show people a few of the problems you
Okay.
have
Okay.
with your motor, your coordination, your
Okay.
sensation. We'll watch you walk after
Okay.
that, and then we're gonna spring you.
Okay. All right, sounds good.
So show me your teeth here. Close your eyes really tight. Open them real wide. Raise your eyebrows. Good. All
I
right.
can.
Now I want you to look at my nose. You
Okay.
see my whole face clearly with that eye? If you look at my nose, look right
No,
there.
sir.
Yeah. Is it over here that you have trouble seeing? Can you see it wiggling? Where do you start to see my finger wiggle? Is it got to get towards the
Okay.
middle?
Towards the middle, I see a decrease. I can see it coming in.
Okay, so you can see it out here, and
Yes,
in
sir.
the middle, if you look at my nose, what part of my face is bad? Is it the whole middle
So
part
it's
of
like
it?
more over in here.
Over,
Like
okay,
I have that
okay.
desire to touch whatever I
Okay,
can't see.
all right. And with this eye, it's pretty good.
Yeah,
if you look at
everything's
my
perfect.
nose. Okay. Yeah, and you can see way out here.
Yes, sir.
Okay. Yeah, show me your teeth again. Open your mouth real wide. Say ah.
Ah.
Good. All right. You hear my fingers on both sides?
Yes, sir.
Yeah, just lift your shoulders up
Okay.
like that. Good. Now hold your hands like you're holding a platter.
Okay.
Okay. Close your eyes for me and touch your nose to that fingertip. Bring it in.
Okay.
Touch your nose. Good. And do it with this hand.
Okay.
Good. Now open your eyes. Now hold
Okay.
your hands like you're stopping
Okay.
traffic. Point your fingers at each other like
Okay.
this. Good. Now tap your fingers over here, just one side, real big and fast. Do that over there. Good. Now hold your fingers really straight.
Okay.
I'm just testing your strength to see
Okay.
how it is. All right. And hold those hands far apart.
Okay.
Don't let me push. Good. And you're quite strong up here today.
Okay.
Although the grip might be ever so slightly off. Push me really hard on
Okay.
the left. Yeah, I mean, it's pretty good. Lift your knee up in the air like this.
Okay.
Look right at it. Lift it way up. Lift it way up.
Like that's about as
Yeah.
far as it's going over
That's
there.
as far as
That's
it
true.
goes. And
But
lift this
over
one
here,
up.
like
That
I'm-
one's stronger. All right. And hold your heel back towards
Okay.
you. Pull
All right.
really hard. Pull really hard over here.
Okay.
Okay, good. And I want you to do this for me. Bring your feet out this way. Point your toes apart.
Okay.
Don't let me push, okay?
Okay.
Yeah, good. I mean, you're darn strong now compared to how you've been. So, we're just going to check a few other things. We're going to look at your reflexes. Reflexes are a way to look at
Okay.
how much problems there've been in the nervous system, and yeah. And we talked to you already about cutting the steroids back a little
Yes,
bit
sir.
slowly. Yeah, if we can't cut it a lot, we cut it a little. So, can you feel that's a cool temperature? Is it cool?
I feel it better in the right
Better on the
than-
right. Can you feel the humming just a little bit?
I feel it over
But
here.
over there. Okay, so if I make it stronger, can you feel it? No?
I feel that it's there, but I don't feel it like I do
you feel it
in.
humming now?
Yes, sir.
Yeah, so you can feel it a little bit there. How about down here? Can you feel it humming there?
Yes, sir.
And how about
Yes, sir.
there? Yeah. Okay, good. All right. Now we're coming over here.
To the part I hate.
Oh, you hate pins?
I hate this part.
Are they
Okay.
off over here? Can you feel it over there? Can you feel it on the left or not? No, not really. How about in your belly? Sharp there?
It's sharper on the right than the
Sharper
left.
on the right. How about your face?
It's sharper on the right than
Okay,
the
so
left.
it's pretty much the whole left side as far as you can tell. Yeah. But you can feel it sharp, but it doesn't feel the same.
No, sir.
Okay. All right. Well, good. All right. So let's just, we're going to watch you walk in a minute, but I
Okay.
wanted to go over, what we decided to do today is we're going to keep looking. I believe did we try already sign some paperwork for
Yes,
the
I've already signed
Solaris?
everything.
Okay.
Yes, sir.
And they're waiting, they told me they were waiting to see, so I'm going to have to tell them to proceed even though that test is negative, that we
Okay.
really want to try to get the medicine. I don't know how long or how successful it'll be because of the price of the medicine. If we appeal it and they say no, then they'll probably just give it to us. The other thing is, we don't know exactly when, but almost any time they could approve another medicine that
Yes, sir.
that will likely be more accessible, and we would try that instead. But you've got another dose of Rituxan. You're on steroids. We're going to cut the steroids. You won't have a new problem while you're on steroids, all right? But you can't stay on steroids forever.
Right.
It's hard on your body, and so that's kind of how we approach it. And we many times are successful over times at beating it back and getting it under control where the problems are really quite rare. We do put you more at risk for infection by doing that. That's probably the biggest thing. And while you're on steroids, these metabolic issues with blood
Yes,
pressure
sir.
and diabetes are an issue, but those are manageable by other means, and they are short-term issues. In the long term, we're trying to prevent the serious damage in your nervous system, and
Yes, sir.
it's working a lot better today than it has been. So, do you have any questions for me?
No, sir.
Okay. Well, you've kind of.
I have not a doubt I wouldn't be here if it wasn't for you.
The best thing you can do is try to keep the salt down in your diet. Be really careful about the diabetes. I'm a big fan of Weight Watchers just because it teaches people exactly what they can eat. And then the medications you're on, you have an excellent physician who's managing your medical issues.
Yes, sir.
And that's vital because we can't do that in neurology.
Yes,
We
sir.
don't know how. All right. Well, we'll examine your walking. now.
Okay, all right.
And I'm just going to have you walk one way and then the other, and then
Okay.
we'll have you try to
I'm
balance.
still kind of holding on to the
Yeah,
wall. when
and
I-
that's fine. If you
Okay.
have to do that, I want
Okay.
you to turn around and walk that direction towards the camera.
Okay,
first,
that way? Okay.
Yeah.
All right.
Are we ready? Are we ready, Bill?
Okay.
Okay.
Which I'm really stubborn. I won't use a walking device. I know it's probably coming at some point in time, but
Do your legs feel stiff? Do they feel stiff?
they
to
feel
you?
weak.
Yeah, they feel weak
Like
to you.
jello,
All right.
kind of weak.
All right. Turn around for me
Okay.
and come back this way.
Okay.
Yeah, you have a little bit of difficulty with lifting your legs.
With this right one.
Do you feel like you're going to fall down? Is that why you hold on to the wall?
I don't think I can balance well right
Yeah,
now.
okay.
Because
All right.
like I can't put my weight on the right leg. And then I'm depending on this left one so much, I think that's why it's hurting.
Oh, okay. Are you hurting?
My
Where-
right one's hurting, like it's
Ah.
burning.
It's burning.
All the way down.
Okay, all right. Really good. Just walk towards me
Okay.
a little bit more.
All right.
You can't bring your feet together, right?
Oh,
your
no.
balance isn't. Okay,
No,
don't do
it's-
it then if you don't
It's
think
not going to
you need it.
happen. Like I
All
can't
right.
balance on one foot or.
All right. We're good.